Guys, last year, the UK government announced that they will be increasing IHS fee. IHS means Immigration Health Surcharge. It is what immigrants pay when they want to come into the UK. In fact, you have to pay your Immigration Health Surcharge fee before you pay for your visa application fee. It's that serious for them. This fee usually covers your healthcare when you're abroad. Like, it's like an health insurance that you pay to the UK government. So once you paid your IHS, you can see the doctor in the UK for free. You only have to pay for your prescription. But seeing doctor, going to the NHS, using NHS services are usually covered under this Immigration Health Surcharge. So they announced that there's going to be a 66% increment by 16th of January 2024. But unfortunately, this new increment will not be able to take place by 16th of January 2024. So on today's episode of Yettysplash, I'm here to tell you why the Immigration Health Surcharge increment will not be happening by 16th of January 2024, and the rationale behind increasing this IHS surcharge in the first place. So if this interests you, please do well to stay tuned to this channel and watch to the end. And also don't forget to like, share, subscribe. Hi guys, my name is Yeti, and on this channel I share information about relocating abroad, living abroad, life abroad, and most importantly helping immigrants to settle anywhere in the world, particularly the United Kingdom. So today we're going to be talking about the Immigration Health Surcharge. I have earlier said that the UK government announced in October that they were going to be increasing it by 66%. So they made some sort of like draft Immigration Health Charge Amendment Order of 2023 to say that, look, we have to increase our IHS fees. And the rationale behind this increment is the fact that they said the current IHS fee is not enough to pay for the healthcare, coverage for immigrants that are currently in the UK. They are saying that the services immigrants are entitled to as a result of the IHS, the NHS still has to contribute more. The NHS is the National Health Services, so they still have to pay, more towards immigrants' health surcharge. And they felt that wasn't fair, and that immigrants should be able to pay the Immigration Health Surcharge that covers, all their own health whatever or problem as a result of staying in the United Kingdom. So they are planning on increasing it from £624 to £1,035 for adults, and for children from £470 to £775. And this is paid per annum, guys, meaning if your visa is for 3 years, they'll calculate the Immigration Health Surcharge for 3 years. Although healthcare providers are exempted from paying Immigration Health Surcharge, but that does not mean other visa category holders would not pay. They will have to pay. In fact, especially for students, so if your master's is for a year, you have to pay for IHS for a year. If your master's is for 2 years, you have to pay for 2 years. So if you're on other kind of skilled worker visa and you're not an healthcare provider, you have to pay for your IHS. So if your skilled worker visa is for 5 years, you have to pay for IHS for 5 years. So imagine you're now relocating with dependents. You pay for yourself as the main applicant, you pay for your partner, you pay for your children. It's a whole lot of money. But then the rationale behind this increment is the fact that they said the Immigration Health Surcharge does not cover for immigrants' expenses, healthcare expenses in the UK. So they decided to increase it. But at the end of findings, it was discovered that the IHS fee has only increased by 25% from the last time it was made. So this 66% increment is unjustifiable, and that is why the House of Commons had to sort of like do a re-debate on the draft order they have made to make an amendment to the Immigration Health Surcharge. And this is the reason why the law is not going to be taking effect on the 16th of January anymore, because as at the time the order was made initially in October 2023, it was stated that the order will come into effect on the 16th of January 2024, or 21 days after the law has been made, whichever is the latter. So as it stands currently, since they haven't passed it into law yet, and the House of Commons sat on it on 10th of January 2024. So the earliest day in which this new law can come into effect is by 31st of January 2024, or it's a much more later date than that, but it cannot come into force earlier than that. So we're really hoping that probably this their meeting or whatever they're having, their deliberation at the House of Parliament, will kind of like reduce the Immigration Health Surcharge that immigrants has to pay, because it's quite discouraging. Imagine if you're applying for your spouse, that's one, and you guys have like a three-year visa. Do you know what that means? £1,000 times 3, that's already 3,000 for husband, £3,000 for wife, that's already 6,000. That's for health surgery. It is not inclusive of your visa application. It is not inclusive of any other thing that you're paying. It is not inclusive of your flight. That is just for immigration, health surgery. And to even bust your bubbles, guys, it does not mean that when you come into the UK you even have to go to the hospital. Some people stay in the UK and they don't even need any healthcare services, and at the end of the day you don't get a refund for what you've paid. So what I mean, so it's a lot of money. If they can either maintain it or increase it by 10%, I think that is reasonable. But a whole whooping 66% increment is not really, in my opinion, reasonable. But then again, I'm an immigrant, my opinion does not count. So it's quite funny. So well, I'm really happy for those that want to put in application or that are applying to come into the UK either for January, February intake. You guys still have the opportunity to pay the current rate now. If it comes into effect by January 31st, then you'll have to pay that that fee. But for now, enjoy it while it lasts. I'm hoping that it doesn't come into effect anytime soon. Okay, this increment is being implemented to continue to deliver Conservative Party 2019 election manifesto commitment to ensure that the immigration health surcharge covers full costs of the NHS for treating people required to pay. So who are those required to pay IHS? They are immigrants like myself and yourself, hopefully, if you're watching as an immigrant. So they just want to ensure that whatever we are paid is what NHS is spending on healthcare services for immigrants, and that the NHS are not bringing out anything from their pocket. So they're basically using our money to pay their doctors and things like that. But it is well. Anyways, this is the update I have for you guys. So I really do hope that they find something to do about it, and if they don't, immigrants will have to pay the new fare. I mean, that's why we're immigrants. We don't really have a choice. We don't have a say when they decide these things about us. So don't forget to like, share, subscribe, guys. Click on the subscribe button. This is where you get, Yettysplash is your one-stop shop for everything immigration news, information, updates back to back as they're releasing it and giving it to you. Like, I'm your regulatory watch, if you understand what I mean. I'm just here to ensure that you get information at the right time. Okay, so don't forget to like, share, subscribe, follow for more, and also follow me on all my social media platforms on Instagram, Telegram, and then here as well on YouTube. So I still remain your one and little baby girl Yeti. Stay blessed. Bye guys.